He is the distinguished professor in environmental science and medical studies and director in environmental health science program. He's also an editor-in-chief in environmental science technology letters. Today's the title is the lesson learned from the Uncover EH initiative. Please welcome Professor Bryan Brooks.
Well, thank you for the opportunity to join you. Always have valued my interactions with my colleagues at Seoul National, and maybe sometime I will actually visit your campus again. I must say that I very much enjoyed the previous presenters' perspectives, and actually the most recent talk by Dr. Coach, it reminded me of an UBA environmental specimens bank project that we completed and published about a decade ago. Fascinating and very unique type of resource. I'm going to change gears. I'm not going to talk about maybe some of the topics that if you're familiar with the work that we've done, have typically engaged. Instead, we're going to focus on environmental public health practice, specifically focusing in the United States through something called the Understanding Needs, Challenges, Opportunities, Vision, and Emerging Roles in Environmental Health initiative that was initiated by the National Center for Environmental Health at the Centers for Disease Control and Prevention. Maybe you've seen these headlines. Asia accounts for 99 of the top 100 cities facing the biggest environmental risks. We think about the previous presentations and the exposure scenarios that are really important. But these are the types of headlines that we see around the world. We see them routinely. What we are not perhaps appreciating is that the public may not actually know what environmental health is, or that there are people working behind the scenes in practice in local communities until something bad happens and headlines like these show up on the front page of the news outlets or on some sort of a media source. So we were interested in asking the question, what are the key challenges and opportunities facing environmental public health practitioners, specifically in health departments in the United States? Because these individuals are responsible for delivering the 10 essential environmental public health services. If we deliver the essential services, we can protect the health of local communities. I'm a very simple guy. I have my ideas, you have your ideas, but maybe we should ask the people that are working in the health departments in state and local and federal levels what they see as some of the biggest challenges every day. This is important because environmental health is profoundly local. Water, the exposure issues, the impacts of the pandemic. In the United States, this is the second largest public health workforce after nursing. The people are involved with diverse activities. We knew this going in, but oftentimes considered an invisible or a silent profession until the problems actually occur. And we also know in the United States, different states, tribes, and territories may have different structures in the way that they deliver services. Oftentimes, this has been described as a fractured health delivery system. I remember a few years ago when we had Zika virus outbreak in the United States. The Centers for Disease Control and Prevention did not know which counties throughout the country had well-developed vector control programs, yet we know that if we have well-developed and implemented vector control programs for 1 to 2 years, the risks of Zika and other vector-borne diseases are minimized. So what are the workforce challenges? Well, there have been previous survey-based approaches in public health. Maybe you're familiar with Public Health Wins, the Public Health Workforce Needs and Interest Survey. However, although there are some summary statistics, there had not been an effort in the United States to actually examine environmental health, the second largest part of the public health workforce since 1961. And so we launched with the CDC and in partnership with the National Environmental Health Association in the United States, it's the largest practitioner-based organization focusing on environmental health, also with international membership and activities, this unique initiative. All of the information is found at this website, including the manuscripts that have been published and some other communication tools that may be useful to you. I would also argue that although this focused on the United States, the interest in the approach and the observations that I'm going to share over the next few minutes has led to conversations intended to launch similar types of activities in Europe and also in Latin America in the coming years. It was really an unprecedented opportunity. Can we describe the workforce characteristics, the backgrounds, the trainings? Can we understand the needs for preparation of the workforce so that we can then respond as the next challenge emerges? This started before COVID. Can we forecast emergent concerns? Can we identify major research questions affecting the practice, including grand challenges? We used a program-based approach from our experiences with horizon scanning, which, as you may be familiar, is a very common public health approach. And the Global Horizon Scanning Project drew some parallels where we had identified strategic research questions around the world related to achieving more sustainable environmental quality over the next decade. This is a very unique partnership with Society of Environmental Toxicology and Chemistry, and in North America with the American Chemical Society's Environmental Chemistry and Agrochemicals divisions. The point is, this was a transparent, inclusive, and bottom-up activity, much like the Uncover EH, where we first surveyed people and then performed synthesis workshops with experts from different areas with different geographic representation, while also balancing the type of work, responsibilities, and career stages. We followed the same model that we used for global horizon scanning for Uncover EH. If you're interested in global horizon scanning, here are the 5 papers that have appeared thus far, identifying strategic research needs to achieve more sustainable environmental quality in different regions around the world. Some of the colleagues participating tonight were involved specifically with the recent article from Asia, so you may see some common names here, including Professor Choi. So back to Uncover EH. I'm a simple guy. Why don't we ask people that are doing the work to help us think about what are the problems that they're facing in the health departments of local communities? Because environmental health is profoundly local. So that's what we did. We partnered and we asked people, receiving over 1,700 responses from environmental public health professionals in the United States. Notice the age distribution from the respondents. The majority of the people are over 36 years old. Very limited early career people are being integrated into this profession. 25% of the respondents plan to retire in 5 years. This survey was conducted several years ago, again before COVID. Yet only 6% of students in schools and programs of public health in the United States are focusing their studies on environmental and occupational health. So 26% of this part of the workforce, the second largest workforce in public health in the United States, plans to retire very soon. And only 6% as of a few years ago of the students were focusing on this area of study. What else did we find? Position titles, they're called different types of people. Maybe they're an environmental health specialist, an older term, a sanitarian. Some regions of the United States, they're called inspectors or environmentalists. You see different types of titles used by health departments throughout the United States. Education and training, 72% had bachelor degrees. And there was quite recent training that had been identified in terms of 90% had completed additional training just in the last year. Impressively, almost 90% of their employers are supporting their travel to attend additional training. We saw this as positive signs. However, if you look at the undergraduate degree types, very few of the people have undergraduate training in environmental health or public health or environmental science. A lot of biological science, but even people with non-science backgrounds are involved in these positions in the workforce. What we also see is that in a typical health department setting, environmental health professionals tend to capture a lot of the programs and many of the new programs that become problematic. These are percent of respondents that are involved with different environmental health programs. The most common are things like food safety, water quality. The third most common is emergency response and disaster risk reduction. Remember, this happened before the pandemic. We also see emerging roles in a number of areas, from sustainability to urban planning, and certainly a lot of involvement in core environmental health programs like vector-borne diseases, public health pests. We also observed that the typical environmental health professional are involved in multiple programs at the same time. So what is emerging? An older population of a workforce that's not actively recruiting new people in at the younger level, that are taking on the new challenges that are emerging and are already responsible for delivering multiple programs. So the people cannot be specialists, they must be generalists. They're juggling many things. In 2020, we contributed this article, Identifying Some Needs to Advance the Profession in the Workforce. We draw conclusions that are eerily similar to this comment from 1942 in the same journal, that the work's further expanded through the broader program of local sanitation work, as it was called then, resulting from better coverage of previously recognized problems and the appearance of new modern problems. Eerily similar in Uncover EH, what we see, to observations many, many years ago. And if you're interested, there are 29 priority problem statements. This received a special focus in the American Journal of Public Health when it was published in April of 2020, along with some very kind commentaries from other scholars in the United States and from Europe. If we look at the priorities, again, that affect the workforce, the number 2 priorities, perhaps not surprising what I've described already, is that retaining trained staff and recruiting qualified applicants are the 2 biggest challenges that the workforce is facing in the United States in environmental public health at the health department level. We also identified a number of environmental practice challenges and research needs. And again, 29 priority problem statements were grouped based upon common environmental health programs like drinking water, wastewater, food safety, healthy homes, and emerging issues, which included everything from disaster preparedness to contaminants or things that are being included into foods, especially in parts of the United States where cannabis and other activities are now legalized. There were several key recommendations that came from this activity related to academic preparation, improving the professional credentials for people that are already in the workforce that may not have professional training in public health. The registered environmental health specialist credentials are not consistently required among the states, tribes, and territories, but represent an opportunity for the existing workforce to actually improve its understanding. We also recommended strategic national training that not only focuses on environmental health staff, but also thinks about the interface of the environmental health professional within other aspects typically found in a public health delivery system. Other key recommendations were related to non-traditional partnerships, reminding you that this was published just about a month before the world became aware of the Wuhan strain of the COVID-19 virus. Developing new and non-traditional partnerships is necessary, especially in somewhere like the United States, where the structure of the environmental health programs are really fractured across the states, tribes, and territories. Developing the local partnerships will really become important as we move forward. We also recommended the importance of leadership training, using a project team-based approach. Sometimes individuals in environmental health, much like the existing environmental health workforce of the United States that's aging, preparing to retire, not consistently trained as undergraduates in public health or environmental health, taking on many different programs and responsibilities, and oftentimes understaffed, not able to recruit qualified individuals and replace people who perhaps have left for other jobs. Subsequently, the communication and the partnerships across the different areas of public health does not appear to be as strong as it could. We think that team-based joint leadership programs have merit. We also identify the importance of translational science partnerships. This is not consistently employed, for example, in strategic ways within some of the gold standard funding activities in the United States. It tends to be more one-off. For example, our community outreach cores within a typical NIH grant structure may have strategic benefits to engaging and then disseminating some of their translational findings more broadly in partnerships with this workforce. We also recommended strategic research at the national scale. This is necessary, we argued, to address historic threats, the emerging threats that we observe. More information, of course, at the CDC website and in the publications. Little did we know that the emerging threats would include a game-changing global pandemic. We also suggested the importance of the integration within existing programs, strategically developing research activities, not just in partnerships through outreach activities, but working closely with the basic and translational researchers during the design of future research activities. This paper and the Uncover EH initiative has spawned a number of activities, including millions of dollars of research funding that's been identified by the Centers for Disease Control and Prevention that has already been distributed to health departments at the state and local levels across the United States. It's also helping us to think through, how do we actually train environmental health professionals in the United States going forward? There's some synthetic activity going on with deans, directors, and department chairs in schools and programs of public health in the United States. We, for the first time really since 1961, have a new appreciation of the diversity of the activities that environmental health professionals are actually responsible for. Again, if they are well prepared and equipped, they can address historic and emerging issues. They're the backbone of public health in the local community, oftentimes on the front lines. We're now revising the credentialing examinations and preparation materials in the United States based upon findings from Uncover EH to better match what we know about the workforce with their everyday activities. One of the areas that I'd like to end on are some problem statements related to decentralized wastewater. Somewhere between 25 and 30% of the US population rely on decentralized wastewater treatment for treatment and water reuse activities. This is strategically very important in many places around the world. Here are just some of those problem statements. We subsequently have undertaken now R squared, or needs for on-site wastewater recycling research, in which our primary partner is the National On-Site Wastewater Recycling Association. The steering committee includes diverse expertise and scientists and engineers, public health practitioners from various federal agencies and major NGO funding activities. Following a similar approach, we completed a survey early last year, had synthesis workshops in October of 2021, and are currently preparing the first research paper, which has identified strategic research questions related to both the science and the practice of this emerging issue. I live in the state of Texas. Every year, over 30,000 new on-site wastewater treatment systems are put in the ground. Yet it's been estimated that many of these systems across the United States are failing. And in some areas, in poor counties of the southeastern United States, we see reemergence of hookworm linked to poorly treated sewage due to inappropriate implementation or failing treatment capacity of on-site systems. Again, Uncover EH started before COVID-19. This is a workforce needs assessment performed by National Environmental Health Association, and here are some of their executive summary findings. A workforce that was older, overworked, understaffed, was pulled into multiple COVID activities. People have left the workforce, they've retired early, and they've reported as of October 2020 being emotionally exhausted and understaffed. I can confirm this has been the case with my colleagues and my former students. We think we need to really redouble our efforts on building environmental public health back better in the United States and perhaps around the world, especially given the stress that's been caused by COVID-19. Thank you for the opportunity and for the time this evening.